So today, we're going to tackle a topic that's both complex and, incredibly important. Cerebral palsy. We're going to break it all down into a really clear, structured overview, just to give you a solid foundation on the condition.
And just a quick heads up, all the info we're covering today comes from the fantastic high-yield materials put together by DERK Premium Revisions. They are an absolutely amazing resource, especially if you happen to be studying for exams.
All right, let's dive right in. What exactly is cerebral palsy? Well, at its very core, it's a disorder that affects movement and posture, and it's caused by an injury to the developing brain. But here's the part you absolutely have to remember. The disorder is non-progressive. That means the initial brain injury doesn't actually get worse over time, which is a key concept we're definitely going to come back to. So here's our roadmap for this explainer. We'll start with that core concept, then we'll move through the causes and the different types. After that, we'll look at the clinical signs, talk about diagnosis and management, and then we'll finish up with the prognosis and some really high-yield takeaways. Okay, so let's really hammer this first point home because it is so important to get this right. While a person's needs and their challenges might change over the course of their life, that original brain injury that caused the CP, it's static. It does not get worse. Now that we've got the core concept down, let's dig a little deeper, right? We're going to look at the why, so what causes cerebral palsy, and then the what kind, which is how clinicians classify all its different presentations. So, what are the big risk factors? Well, there are several things, like infections, brain bleeds, and some congenital issues. But listen, if you only remember one thing from this slide, make it this. Prematurity is the single most common cause of cerebral palsy. This is a really neat way to think about it. We basically classify CP in two different weights. On one side, you have the type of movement disorder, with spastic being by far the most common. And then on the other side, you have the distribution, which just tells us what parts of the body are affected. So, for example, hemiplegic just means one side of the body is affected. Okay, so with that background on the causes and the classifications, what does cerebral palsy actually look like? What does a clinician or a parent see that might start to raise a concern? Yeah, let's put on our detective hats here. We're basically looking for a pattern of clues, and we'll start with the most common features, the ones related to motor skills. The classic signs are all right here. A child might not be hitting their motor milestones, things like rolling over or sitting up on time. They might have abnormal muscle tone, and that's often spasticity, meaning their muscles are really stiff. And those primitive reflexes, the ones that babies normally lose, well, they might just stick around longer than they should. And this is a huge point, something you absolutely have to understand. CP is often so much more than just a movement disorder. That same brain injury can lead to a whole host of other challenges, things like epilepsy, intellectual disability, or issues with speech, hearing, and vision. And each of those requires its own targeted support. So now we get to the clinical response. Once there's a suspicion of CP, how is it formally diagnosed, and what does that whole framework for management and support actually look like? It's not just one single test. It's actually a pretty careful multi-step process. It always starts with the clinical picture, what the doctor observes. That's then often confirmed with an MRI of the brain, which helps to identify the underlying injury. And then a full developmental assessment helps everyone understand the complete impact on the child's function. And this right here, this brings us to probably the most important concept in management. There is no magic bullet for cerebral palsy. No way. Effective management is all about a team approach. It takes a dedicated, multidisciplinary team working together with the person and their family to provide the best possible support. So, who's on this dream team? Well, first up, you've got physiotherapy. That's the absolute cornerstone, focusing on movement and strength. Then you have occupational therapists for daily activities, speech therapists, and of course, doctors managing medications. And yeah, in some selected cases, orthopedic surgery might also be part of the plan. All right, let's start to bring it all together. As we wrap this up, we're going to focus on the long-term outlook and really boil this all down to the most important, high-yield facts to remember, especially for anyone who's studying for exams out there. Okay, this slide is so important because it clears up a really common point of confusion. Remember how we said the disorder, the brain injury itself, is non-progressive? That's true. But the resulting disability, so the functional challenges, that is lifelong. This is why early and consistent intervention is so key to improving function and quality of life. Okay, exam time. If you take away just 4 things from this whole explainer, Make it these. Number 1, CP is non-progressive. 2, the most common type is spastic. 3, the most common cause is prematurity. And 4, and this is a really important one, intelligence is often completely normal, so you never ever make assumptions. So we'll leave you with this to think about. We know that an early, team-based approach is the absolute gold standard of care. So what do you think are the biggest real-world barriers that stop that from becoming a reality for every single child? It's a complex issue, for sure, with no easy answers. Thanks so much for joining us for this explainer.